Hello, welcome to the African Emergency Room. Thank you for joining us today. We want to thank all those who have gotten back to us in different ways after watching some of our videos in the past. Thank you for all your questions, for your criticisms, for generally getting back to us and taking the discussion above the level at which we've presented it. This means that our society will get better, our healthcare will really improve starting with this new year, 2019. Thank you so much for all your concerns, and let's get on with it. Today we'll be discussing typhoid fever. Yes, typhoid fever. Not the academics of typhoid fever. We are not here to school you on what it is basically and how to treat it and all that medical jargons. No. We're here because of the concerns that we get. Usually here in the African Emergency Room, we want to express the concerns we get from the hospitals, get it back out there to the public, and people know better how to approach things, okay? And then people will ask us the questions they need to be satisfied with. So we're not going to be schooling you on the nitty-gritty of typhoid fever. We're just going to bring out the myth and the truth about typhoid fever, especially as it is in our society today. So today, to unravel the myth and the truth about typhoid fever in our society, we have a special guest in our studio who has been as concerned about the whole presentation of typhoid fever, the whole conception about typhoid fever, as concerned as we've been here also in the African Emergency Room. So we have in our studio today Dr. Tasie Asobie. Dr. Tasie Asobie, I want to thank you so much, despite your busy schedules, for coming here to talk to our viewers and to talk to us about the truth and the myth of typhoid fever in society.
My pleasure.
Welcome to the African Emergency Room. Dr. Asobie, on a light note, according to the University of Maryland School of Medicine report of 1998, Alexander the Great probably died of typhoid fever. Has it always been that serious? Is it still that serious? Should we be really concerned about typhoid fever in our society now?
Yes, we should. We should be really concerned. And it's, to answer your question, it's that serious because it's a disease that involves a particular part of the stomach, which everybody calls stomach, which is the small intestine. And if not properly treated, if not properly checked, it can lead to perforation of that small intestine and subsequently become a surgical emergency, which most often, if not treated, if not operated on, leads to death, especially in smaller children.
So it still kills even today?
Yes.
Okay, fine. So how can somebody actually get typhoid fever?
Typhoid fever is a bacterial infection that is gotten through a fecal-oral route, which is that it is contaminated food that has been contaminated by feces of an infected individual. And it normally happens or occurs in places where there is poor hygiene, in people of low socioeconomic class, and where there is overcrowding.
Doctor, excuse me. I want to understand this fecal-oral route of transmission of typhoid fever very well, especially for the sake of our viewers. So you're saying that someone who has typhoid fever goes to the toilet, does his business in the toilet, maybe doesn't wash the hands properly, and maybe touches what we eat or drink, and we eat it or drink it, we get typhoid fever.
Yeah.
So if the person doesn't have typhoid fever, and then our food is contaminated by his stool, we don't get typhoid fever?
No, but you can get another disease if you're not careful.
Yes, no, we're not saying we'll be eating stool here. Okay. We're just trying to make sure of how we get this typhoid fever. Typhoid fever in itself. Right. No, nobody should go there touching stool that is not contaminated with typhoid fever. There are other things that can be there. Yeah, but we're saying typhoid fever comes from someone who has it. Contamination of the stool of someone who has it. Okay, thank you so much. So how do we know we have typhoid fever? Like, I'm a lay person. Yeah, the contamination has happened when I didn't know. I just went to the nearby buka. I didn't know that the owner of the buka or the woman or the guy who cooks in the buka had typhoid fever and had gone to the toilet without washing his hands, or washing his hands without soap, or washing his hands improperly, and has touched the food he gave me, or the salad he gave me, or the water they served me, or the locally made juice they served me. Okay? And then what would I start seeing? From what period would I start feeling sick, and what do I start seeing and that should make me suspect that something like this is going on? So these questions I've just asked now, I'm sure people are paying attention to know what you're going to say to this. Let's go for a break. When we come back, you tell them all this. We'll be right back. Welcome back to the African ER. Before the break, we had Dr. Subie here in the studio trying to give us the myth and truth about typhoid fever. So before we just went on that break, I was asking him how someone who just got infected with typhoid fever would know. What are the signs? What would the person start feeling? What are the symptoms of typhoid fever that an individual will detect from himself or herself?
Thank you for that question. It's very important because a lot of problems that arise from treatment of typhoid fever is misdiagnosis. Typhoid fever has a common symptom which is common to most diseases, which is fever. Okay? So there's this misconception when you have malaria, people think you have malaria and typhoid fever. There's a difference, and a very significant difference. The significant difference is that in typhoid fever, you have a very high fever. Temperatures ranging from 39 to 40 degrees. In fact, it is said that the temperature increases in a step ladder form, gradually, one after the other, from 38 to 39 to 40, up to 41. That is one significant difference between typhoid fever and malaria. Secondly, patients with typhoid fever tend to have a severe headache, a terrible throbbing headache, and that's one of the major symptoms they will tell you about. Thirdly, is the fact that because of the thing I described earlier, they are going to have serious abdominal pain, and they can present with vomiting, passage of watery stool or loose stool, or constipation, or in some cases, alternating constipation and diarrhea. So those are some key symptoms that people who have typhoid have, as opposed to people who have malaria, who have low-grade fever or intermittent fever, fever that comes and goes towards the evening, joint pains, generalized body weakness, bitter taste in the mouth.
Okay. Now, these symptoms you just mentioned, are they still that common? Because the way people take paracetamol when they have fever, people take antibiotics, they just go to the nearby drug shop and buy antibiotics and take whenever they feel anything. And the way people take the one they call agbo, commonly here and there, will they still have these classical symptoms of typhoid fever?
So in this case, the classical symptoms of typhoid fever are not common in adults. They are common in children. But on the other hand, a lot of parents start antibiotics for their children without prescription, without going to the hospital. They are treating malaria and typhoid. So in those cases, they may not have those classical symptoms. But by the time the patient presents in the hospital, most of the time, we have children that are now presenting with typhoid perforation because they have used analgesics and antibiotics to mask the symptoms. So, but on rare cases, you see people presenting with the classical symptoms, and most of the time you find out that these people have not used antibiotics. They've just probably been treating malaria over and over and over again.
All right, thank you so much, Dr. Subie. There is this case of patients who keep coming to the hospital and you ask them, what is the problem? They'll tell you, I have malaria and typhoid. How did you know that? I went to a lab and they did test for me and they said I have malaria and typhoid. People go to the lab here and there and they come with the diagnosis of malaria and typhoid. Malaria, maybe I can understand because this is the tropics, the mosquitoes bite, they transmit it here and there. But the typhoid, from what you've explained to us how we can get typhoid fever, are we saying that there are so many people out there who just go poo and rub it on people's food and drink and everybody's just getting typhoid fever? Why is the diagnosis of typhoid? And the people telling you they have typhoid fever, you're looking at them, they are not presenting with any of these things you've been telling us here. So what is the myth and what's the truth?
All right, thank you for that question. I will start with the myth. The myth is the fact that a lot of people say that the best way to or the only way to diagnose typhoid fever is using the Widal test. The Widal test is a test that detects the level of or titer of the Salmonella typhi, which causes the typhoid fever, or the paratyphi, another variant of Salmonella that also causes a form of typhoid fever. But it is not specific for typhoid fever. It has been found that people with other infections will also present with or have a high titer value of the salmonella, especially if it's sometimes a chest infection which salmonella causes. But the truth is that the best way to diagnose typhoid fever is with blood culture, urine culture, and stool culture.
Well, before you expatiate on that, the Widal test, I had seen in the lab where Widal test, of course, we were taught in medical school, and then it's been bothering me right from medical school. You know, they take your blood and drop it on tiles, on a tile, okay, and then they drop the reagents and mix them, and then they start mixing, and then it's okay. This one is 1/80, okay. So this one should be 1/160, you know. And then I imagine that if somebody else picks it up, the person might see the one that was 1/80 for you to be 1/160 for him or whatever. So that it's subjective. I used to think that Widal test was subjective. It depends on the viewer. Like you're using glasses, I'm not. So it will depend on who is viewing and who is doing the test.
It's highly subjective,
so,
yes.
In addition to the fact that other things can raise the titer of Salmonella typhi and all the different forms of the paratyphi. Thank you so much. So what is the right way to make the diagnosis?
Well, in the past, it used to be blood culture the first week, urine culture the second week, stool culture the third week. And of course, most of the times they present late. Patients come after the infection has been going on for a while. And they've treated with antibiotics. So most commonly, when they come, we try to do a stool culture. But recent studies have shown that now, the first week, you do more of bone marrow culture, then blood culture, then stool culture. Because urine culture, most of the time, you're looking at something else. There are other pathogens that are commonly found in the urine and also can mask the salmonella. So for now, most of the time, it's stool culture we go straight into to identify the salmonella in the stool.
Okay, thank you very much, Dr. Asuke. So you're saying that the 50% of the patients we see at the general outpatient that tell us we have typhoid fever may not actually have it. Okay, because they just come to you, walk to you, sit down, not shouting my head, or tummy, maybe no diarrhea, maybe no constipation. I'm just telling you, I've been treating typhoid for years. Each time I go back, they tell me typhoid fever. Each time I go back, they tell me typhoid fever. I don't know, this typhoid fever has refused to leave me. And then those of them that pray, their prayer point is, this is my typhoid fever, this is my typhoid fever. Okay, but thank you for giving us this enlightenment that most of the time it may not be typhoid fever. From what you told us about the transmission, why do you think that maybe you are married, you're a man, you're married, or you're a woman, you're married, or you're not married, but you cook your own food in your own house. You wash your hands when you go to the toilet very well. You take your bath, you cook clean food. You eat only what comes from your house, or maybe your family members that you know who prepared it and how it was prepared, or a respectable restaurant where you know how things are done. So how do you think that there will be stool contamination in your food every time? Every time you eat, you think it's been contaminated. Oh, you have this typhoid fever, this typhoid fever. No, but there are those they call carriers of typhoid fever, chronic carriers. Dr. Sobi, who are these people?
I was actually waiting to talk about that. There are people who have been infected with typhoid fever, but do not exhibit symptoms. Okay? These people have become chronic carriers. They transmit the disease, but they do not exhibit any symptoms. And we have found out over time that some of the commonest carriers of typhoid fever, unfortunately, are food handlers. People working in canteens, bukas, restaurants, okay? And their immune system has been able to adapt to the point that they've been able to fight the infection, and the infection is more or less quiescent in them, but it still makes it possible for them to transmit it. Okay, so ordinarily I would say that anybody who wants to open an eatery, whoever you're employing has to be screened.
The food handlers test.
Food handlers test has to be done for each and every one of them to avoid them infecting other people, because you do not ascertain or guarantee that these food handlers will be washing their hands each time they handle food.
Okay, so even if they contaminate our food with poo a bit, it shouldn't be typhoid fever. That's an understanding. Thank you so much for watching so far. Thank you, Dr. Subi. We can't thank you enough. For sure, you will come again.
Of course.
Because
It's
we
my
have
pleasure.
common concerns of things that happen around us and we'll keep talking about them. Thank you. God bless you.
Thank you very much.
Typhoid fever. Typhoid fever. Every time typhoid fever. It's not like that. You've heard from our guest today that most of the typhoid fever we talk about is misdiagnosis because the Widal test does not help you with diagnosis of typhoid fever. So before anybody tells you you have typhoid fever, the person must have checked your blood, cultured it, cultured your urine maybe, cultured your bone marrow aspirate maybe, cultured your stool at least. The good thing about culture of anything coming out of the body is that it also gives you sensitivity reports. That means it tells you which antibiotics can easily kill this and which one this organism has developed resistance for. Because you may end up taking antibiotics and wasting it and killing normal flora in your system instead and not taking the right antibiotic. So it's always good to culture, especially those of you that have been told over and over again that you have typhoid fever. You don't really have these symptoms he has mentioned, but then there is one customer somewhere that you keep giving money to and they keep doing this test for you and telling you you have typhoid fever. Culture something and be sure. Most of the time I tell patients, you sitting down before me, you don't have typhoid fever. But then I have to be sure by doing one of what he has told us, at least, or all of what he has told us to do to confirm that somebody has typhoid fever. That said, make no mistake about it, typhoid fever is deadly. Back in the day, it used to kill about 20% of those that get infected with typhoid fever. These days, with advent of antibiotics, the percentage has reduced. But ignorance still doesn't help us in this part of the world. Don't be among the few percentage that will be killed by typhoid fever. Don't allow it perforate your intestines or those of your children because these symptoms are more in children, the intestinal perforation, in children, teenagers, in younger adults. Don't let it get to that point because when it gets to that point, we'll be talking more than typhoid fever. That's a topic for another day. So if this video has helped you in any way, or if you have questions, because I know typhoid fever has been a major concern for so many people, if we've not satisfied you, you want to ask questions, send us your questions on our website, theafricaner.com. Send us a mail. It's on your screen. Ask any question you want to ask about typhoid fever or any other health issue. Let us be your health education platform. Thank you so much. See you next time.